Have you ever inquired about whether or not the men in your family had prostate cancer?
I done checked all of them. They dead and gone. I can't ask them. No, I'm just kidding. You know, a lot of them just die before you can ask them anything. Because, you know, black people never got help. We just had to deal with it. You ever notice that?
That's
Even
right.
when they go to Vietnam, they come back. White people got help. They went to see a psychiatrist. They went to see other doctors that can help them. We just had to deal with it. You know what I'm saying?
We go to see the preacher.
Yeah, we gonna see the preacher, and he gonna grow out of it. You know what I'm saying? You know, we always have to grow out of everything we go through. He'll grow out of it. You're not gonna grow out with no lump on your forehead. That is not gonna grow out. Either your head gonna get bigger, or that lump gonna get bigger. So we don't, we can't grow out of everything.
That's right.
So we got to go get some help.
So the bottom line here is that we got to encourage our black males that even if the doctor does not recommend it, and in this environment that we are currently living in, there is the possibility that your doctor may not tell you, as an African American, you need to get checked out. So you need to ask him. Now, I know that's going to be hard for a lot of brothers to do.
It's going to be hard, but I can speak for my doctor. She asks and tell you. She's very thorough. You know what I'm saying? So we have to just man up. The word we use, we got to man up and go and do it.
That's exactly
You know
right.
what I'm saying? Because my goal is to watch my grandkids grow up.
And that's the bottom line. I oftentimes have to tell men that, look, now you know, the other thing that men always ask me about, if I tell them, well, you got something wrong with your prostate, the next question they want to know about, right?
Yeah, they want to know if they can still please their wife or they 3 girls on the side. You know what I'm saying? I know how it is. They want to see if they can get an erection. Am I right?
That's exactly right. And I can tell you that if they get to the point where they have to have their prostate taken out, or if they have to have radiation, or if they have to have chemotherapy, there are doctors who specialize in helping men get an erection after the prostatectomy has been done.
Okay, but what about before? You know these doctors, can we see them now? We talking about before you get anything removed. Can we see these doctors now? We need to see them right now. We need that erection done this evening. You know what I'm saying? I didn't say this late in the evening. I say this evening, So we need to see those doctors right now. You know what I'm saying? Because every man go through that. They have that fear of not getting an erection. And
Well, it's interesting that you should mention that, because after you get past 40, we all going to have a letdown.
Oh, yes, sir.
At some point in time, okay? A lot of guys just don't talk about it, but it's normal for you not to be able to get an erection so that you can perform. But with reference to having good health, keep this in mind, Bruce, that good health in general goes hand in hand with having a good erection. So if you're in good health, more than likely you're going to have good erections. But if you have any medical issues, it's going to affect your ability to get an erection. So I always tell guys, if it's good for your heart, it's good for your Johnson.
You better believe it, boy. You said something.